Hey guys, welcome back to the channel. My name's Tony Maritato. I'm a licensed physical therapist, and I want to speak to the question of how painful does physical therapy need to be for it to be effective following a total knee replacement? Well, the simple answer is it doesn't. It just doesn't. It doesn't need to be painful. I'm sure there's going to be a line of clinicians outside my door next week saying, how could I say that? But it's true. I mean, the reality is therapy does not need to be painful, but there are lots of factors coming into play when we're making this decision. So this video was prompted by a post in my Facebook group, Total Knee Replacement Support Group for Kind People. You're welcome to join. It's totally free. Where Sharon was asking about, how painful it needs to be effective. And I said, it doesn't. The reality is, I believe your body, will tell you what it can tolerate. I think any clinician you talk to will say there's a difference between pain and discomfort. Discomfort may get intense. Discomfort may be turn into pain, but there is a distinction between discomfort and pain. And once you cross the pain barrier, you're done. There's no more benefit to it. It really starts to cause many other problems, that increase soreness, increase resistance, increase fear and anxiety, difficulty sleeping. None of those things are helpful to your recovery. So when I treat a patient, especially a new patient, one of the things that we always talk about is the discussion around pain. And I'm going to be the first one to tell you there's actually patients out there that want to experience pain, or at least what they describe as pain. They feel like if they're not pushed to the point of pain, that therapy is not effective for them. I don't think that that's true. And so obviously I'm not the best therapist for those patients. There's also surgeons that, may believe that we need to push through the pain, and I'm not the right therapist for that surgeon's patients. But the reality is, if we're looking at increasing range of motion, you need to work with a therapist who understands the basic physiology of the human body, the basic structures, the mechanical advantage, and how everything works. And that therapist, along with your feedback, because we can't feel what you feel, needs to make the best educated choice on how aggressive to stress the tissue. But we also have to understand that pain can be related to lots and lots of different causes and different reasons. A great example, I had a new patient today. First time I was working with this individual. He had a total knee replacement approximately 2 years ago. He was experiencing a pinching sensation behind the knee. His knee flexion was limited. He wasn't able to get to 90 degrees when he arrived at the clinic. And so this is a young, otherwise healthy, active person. Played college sports, like just really, really great. I mean, just really way ahead of schedule for a lot of things, but had this mechanical barrier. And no amount of pain, no amount of pushing through the pain is ever going to improve his situation. This is a biomechanical issue that we had to figure out. We did a lot of testing, we did a lot of assessment, we did a lot of talking, and before he left the session, we found a couple ways that he was able to virtually completely eliminate the pain he was experiencing behind the knee while still going into flexion to stretch the joint. So it is a challenge. I'm not going to say it's easy, and it does take somebody who is willing and has the time to spend with you to dig deep into understanding what are we feeling, what is causing the pain. Is it an inflammatory response? Is it something in the connective tissue? Is it a nerve problem? Is it something that where the prosthesis is sitting on the bone and maybe there's a bone problem going on? Maybe there's a vascular issue that we're not aware of. There are so many structures and so many tissues, and of course, that's not even talking about the ankle and the hip and the surrounding structures. So when you experience pain in the knee, it might be originating somewhere else. You've probably heard people say that pain in the knee could be originating in the low back. Lots and lots of stuff to consider. My goal in this video is to, just clearly put your mind at peace to say, no, therapy does not ever have to be painful. Yes, there's a time and a place for discomfort. If you've ever been working out, you know that to gain the maximum benefit of the workout, you need to push and tax your body to the point of discomfort. but not to the point of pain, not to the point beyond discomfort. So I would tell you that if you're not happy with the therapist's particular treatment philosophy, if you feel like you could improve more doing different things or going in a different direction, listen, we're human just like you. We have good days and bad days just like you. We make mistakes. I've pushed people too far. I thought that I was staying below the pain threshold. Later I find out that we overdid it, and they were not very happy with me for the next couple days. But that being said, I want to say, you give your therapist the best shot. You give them the benefit of the doubt. But if it's just not going in the direction you want it to go, you are the person in charge. This is your body. This is your knee. You might decide you're okay with it taking a little bit longer to get the range of motion that you want, rather than having to suffer through the pain and then all of a sudden now you're less functional for the next 3 to 5 days. I don't know that answered the question. I hope that it did. And I will say, back to the post here from Facebook, that there are times where therapists have to go out on vacation. They have to, be out for personal reasons. You get a different therapist. All of a sudden that different therapist has a completely different approach than the previous therapist. Sometimes it works to your advantage. Sometimes it works totally against you. But you can find physical therapy clinics where you work with the same therapist every time, which is a blessing if you have one that you like. But if you don't, you absolutely can request a different therapist or a different therapy center. There's lots of options there. In fact, I'll post a link down below. I've got a website. It's a directory. It's called MedicareHomeTherapy.com. You can search for therapists in your area. You could even consider working with an occupational therapist instead of a physical therapist. Occupational therapists have an amazing skill set, can really help individuals after a knee replacement. They're almost never prescribed, patients are almost never prescribed occupational therapy following a knee replacement in the home or outpatient, but it is a major, major benefit if you can work with an occupational therapist. So if you want to check out the link, if you want to see if there's any therapists in your area, go ahead and look down in the description. If you want to see the next video that YouTube recommends you consider watching, click on this thumbnail right here. And if you haven't subscribed to the channel, I'm going to ask you to do so. We're growing the channel. We're reaching lots of people. I get calls and messages all the time from people who just want to say thank you for watching the videos. I want to say thank you for letting me know that you're getting benefit from it. And if you ever have questions, we have an amazing community on Facebook, the Total Knee Replacement Support Group for Kind People. Check it out. I'll post a link to that also down below.